Now, the tri-state is experiencing the biggest shortage of ICU beds since the start of the pandemic.
The latest numbers showing we're at 92% capacity for critical care in our area hospitals. Local 12's David Winter is live tonight at UC Medical Center, where a nurse today told him the situation is not good. Not what you want to hear right now, David. Good evening.
Good evening, Kyle. Definitely not. UC tells me that it has expanded its ICU capacity, but a nurse here tells me sometimes patients are turned away if they need specialized equipment.
So when you say you've had to turn away patients, what do you mean?
That means that they have to go to a different hospital, either because we do not have enough beds or our nursing staff is stretched so thin that we are not able to care for them.
ICU nurse Tina Arona says the situation is not good right now in the cardiovascular ICU. ECMO units, those are machines which do the work for the heart and the lungs, are often at capacity. Overall, the Health Collaborative, which compiles data from all the area hospitals, shows bed capacity is at 92% in ICUs. That equates to about 200 ICU beds occupied, and the trajectory is grim. The collaborative says if it needs to expand, it can get beds from its regional cache or a system utilizing beds from outpatient areas and storage areas. It reports the next 2 weeks will be crucial for cases from the recent holidays. Unfortunately, with close gatherings comes more cases.
The breakdown really starts to occur once you create that funnel effect. So if patients are sitting in the ED for a protracted period of time, if we can't get patients out of the ICU and into other beds once their medical conditions stabilize, then things start to stack up. And it's really the stacking that tends to worry us the most.
St. Elizabeth's Dr. Jim Horn says currently its hospitals have enough capacity, but a large surge could cause problems. Across the tri-state, this is what the map looked like in August, and this is what it looks like now. Hamilton County went from 11 cases of COVID per 100,000 to 63 cases, nearly a 600% increase.
Now, guess what? We are getting sick too, because we have at times have to reuse our mask, and whether we like it or not, that is not standard of care.
And that nurse tells me there's not only a shortage of beds, but there's also a shortage of nurses. She says sometimes patients have to wait for their pain medication and have to wait to be taken to the restroom. Reporting live from UC, David Winter, back to you in the studio.
All right, David, good information there. Thank you so much. That St. Elizabeth doctor that David spoke with for that story says there is one silver lining here. Cases of the flu are way down right now because so many people are wearing masks, social distancing, and also washing their hands.
The number